Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Well, speaking of expectant moms, as we're seeing the opioid addiction crisis grow right now, there are little victims that you may not have thought of. When women use opioids during pregnancy, it can have serious consequences for them and their babies. And these women need comprehensive care during pregnancy, and their babies may need some special help when they're born. Dr. Margaret Villers is with the Perinatal Centers with Henrico Doctors, Johnston Willis, and Chippenham Hospital. Thanks so much for being with us.
Thank you.
Now, we were talking before we got started here. What's important to note is some women who may have been using opioids, there are some safe drugs that they can use while they're pregnant?
Yes, many of the drugs that they use for management of opioid abuse are actually safe in pregnancy, and we encourage women who are already taking methadone or buprenorphine to continue on those during pregnancy, to continue to see their opioid counselors, but then also to make sure that they talk to their obstetricians about all of the different medications they're taking.
Yeah, absolutely. Don't want to do anything to put the baby at risk, especially. But let's talk about what are maybe some options or alternatives that doctors can also look at in terms of pain management, because of course pain's a big issue when you're going to deliver a baby.
And that's one of the biggest concerns that all of these women have, is what happens at time of delivery and what happens if I have a C-section. We certainly know that epidurals are safe, and an early epidural is encouraged. It actually has no risk at all to women who are using opioids, and it's a great pain management strategy. And then we also have specialized dosing after delivery to make sure that women, who had surgery for some reason really are comfortable and able to take care of their babies.
Okay, and then let's talk about when the baby's born, sometimes a baby can go through withdrawal.
Right, so that's called neonatal abstinence syndrome. And we're never quite sure how mild or how severe it's going to be, no matter, it differs based on the different drugs women are taking. But we do try to reach out to women before their babies are born to help educate them and give them the tools to be successful mothers. We strongly encourage breastfeeding, we encourage skin to skin or kangaroo care, and then we also educate them on proper environment like dim lighting, less stimulation, and really how to be a good mother.
But the important thing is if a mom is for any reason on a medication for pain, they need to be talking with their doctor to make sure that it's going to be safe for both of them.
Absolutely. And as obstetricians, we never judge our patients. We just want to take care of our mothers and their babies to the best of our ability. And we just want everybody to be honest so that we can do the best things for them.
Yeah, make sure everybody's healthy at the end.
Right.
Thank you so much, doctor. We appreciate it.
You're welcome.